Monkeypox. We've been talking about this for over a month now. We are up to 13,000 cases in 60 countries. The big question is it too late? Can we actually control this virus, or is it going to become endemic around the world? Let's talk about that. So how does this compare to SARS-CoV-2, or the virus that causes COVID? A couple things in our favor. One is that it doesn't seem to spread nearly as easily. It doesn't seem to spread easily through droplets or aerosols. It mostly spreads through contact with those infected lesions, and possibly through sexual transmission. The other is that it's mostly affecting people in a very specific community. If you look at cases around the world, it really is mostly in men who have sex with men. In some ways, that's a good thing, because it means it's a specific community that we can target with education, we can target with vaccination. This could help limit the spread. At the same time, that presents some challenges. People know that men who have sex with men are stigmatized in many countries. That means that they may be less willing to come forward with symptoms, less likely to be diagnosed, less likely to get vaccinated, treated, etc., gives the virus an opportunity to propagate. On the other hand, unlike SARS-CoV-2, when this outbreak started, we already had a vaccine for monkeypox. How is that when it is largely an ignored disease? Because like so many other diseases in low and middle income countries, there hasn't been a lot of research towards it. The reason is that, luckily, rich countries have been paranoid about smallpox being weaponized as a bioweapon, so they've invested in smallpox vaccines, smallpox therapeutics, and it turns out that those treatments, those vaccines, are effective for this other orthopox virus, so that we, out of the gate, had vaccines and therapeutics ready for monkeypox. So that's a good thing. The problem, though, is that we're seeing the same, what we call vaccine apartheid, as we have seen with SARS-CoV-2, which is that there's a limited supply of these precious vaccines, and they're mostly being distributed in rich countries, with low and middle income countries not getting their supply. And I think we've learned the lesson now that viruses don't respect international borders. So if we don't have that concerted vaccination effort, education effort, containment effort in every country around the world, we simply won't be able to contain this virus. Couple other things that worry me. One is that, unlike SARS-CoV-2, monkeypox can have a very long, up to 3-week incubation period. That makes it really hard to think back and to do that contact tracing. The other is that the period of infectiousness can also be really long. You are infectious from those lesions until they are basically scabbed and healed over, and that can be weeks. And I think we've learned from SARS-CoV-2 that if you don't have sick leave in place, if you don't have a mechanism for people to be able to isolate safely, they're not going to isolate, and frankly, we haven't figured that out yet. But the biggest concern is about what we call reverse zoanosis, where the virus can pass from a human host to a rodent or small mammal, which are animals where we know the virus can be sustained and can basically form a reservoir for the virus, whereby it can then continually pass back and forth to human hosts. And if that happens, then the virus will become endemic in many parts of the world.